In that there are proposals out for free medication for those under 21, but seniors see an increased cost. Seeing as hospitals are consistently operating between 15 and 35% over capacity across the province. Seeing as our aging population, everybody over here over 50? The challenge is going to continue to grow. What are you going to do to address the concerns of healthcare within the province? And this is, yes, a 1 minute and 1 minute rebuttal. I will put it on for at least 45 minutes. Carolyn.
Well, I think everyone here has waited too long in an emergency room or too long for surgery, for an MRI, and there are certainly significant deficits in our healthcare system. South Lake has been at overcapacity now for almost since 2013, with too few emergency beds for the number of people who are coming. And so the PC plan is to focus, our priority is to focus on wait times. And the way to do that is to look at care across the spectrum. We need to work with our doctors and our nurses, our frontline care, to help alleviate pressures in emergency rooms. We need to build long-term care beds. And so the PC party commits to building 30,000 new long-term care beds. And that'll help move people who are in emergency who need to be in long-term care out of emergency. And we're going to invest almost $2 billion in mental health, and that will also help do that. So we need this as a priority. Our seniors population will be doubling in the next 25 years. We need to do this right. It's the number one priority for the PC party, and I think it's one of the top priorities for the Ontario government.
Thank you.
I believe that by creating alternative structures that will let the private sector step in, the government burden will be reduced. The same way, instead of just providing a certain amount of money to a certain hospital and they don't have enough money at the end of the year, the amount of money will be tied similar like the Swedish school system that I mentioned earlier, will be tied to the patient. The patient will go and the hospital will get the money that are tied to this particular patient. On the other hand, why don't we have enough doctors in the province? Why? What's preventing them from coming in? What's happening? Did anybody ask associations why not? It's not like we don't have enough trained people. As far as I know, the internship positions, they are very limited. They can't even get in. Why? Why is this happening? I don't know. Personally, I don't know all the details. I would have to really dig into it and find out.
I really think we need to consult with the doctors and consult with the nurses and get their ideas on how to make the system better. I don't think that someone sitting in an ivory tower at Queen's Park has got all the answers. I can tell you that I was at the emergency at South Lake several months ago, and I sat there and I thought about the $1.2 billion that the Liberal government flushed down with the gas plants, and at the government of Ontario savings bond rate, it worked out to $220,000 a month for each of 10 hospitals. Now think about it, $220,000 a month for each of 10 hospitals. Now, instead of having 3 doctors and 3 nurses running around an emergency room with a lineup that's going out to the front door and a 5-hour wait from getting in and getting out, can you imagine what would happen if you went to the hospital and said, look, here's another $220,000 a month in perpetuity as long as you use it now. Emergency.
Oh, you're welcome. No, thank you. I asked my local pharmacist, I said, Brent, you'll know, how many people come in here to get a prescription filled, and then after they see the price of it, say, forget it, I can't take it. And he said, Dave, way more than you can imagine. And plus there's the others who come in and they don't bother getting renewed. They've been cutting their pills in half to try to make them last longer. A quarter of our population does not have access to proper pharmacare coverage. If we're going to provide an adequate healthcare system, we've got to include this universally for everyone. Right through the whole age spectrum, right through everyone caught in precarious work situations, for everyone partially unemployed, part-time unemployed, unemployed, we've got to capture this. In the dental field, we waste, I'm going to say $38 million a year.
Save it for your rebuttal.
Save it for my rebuttal. I'll talk about the teeth then.
Thank you.
Thank you. That's why the hospital for South Simcoe was part of my plan. So these things that have come up over and over again, I have been as part of my plan, and I'm not talking about having no way to fund it. You can't have it both ways. You can't scrap all taxes and put money back in your pocket and have hospitals and have schools and infrastructure. We have the best median wait times in Canada. In Ontario here, we have the best median wait times. So there is more to be done, especially in this particular area. South Lake just got a new MRI, so that's wonderful. If you've ever been there for an MRI, you know what the wait time used to be. I've been to South Lake many, many times over the quarter century that I've lived here and with my children. The Liberal government has brought in 6,000 more doctors, 28,000 nurses. And that's why we have a plan to get people out of the ER who are best serviced somewhere else. We're investing in mental health. Let those people get the service they need outside of the ER. We're investing in long-term care beds and in prescriptions, not just for those under 25, you said 21 to 25, but also those over 65. Thank you.
I'm always
I'm sensing rebuttals all over the place.
Well, the other day I met a man who told me that he had taken his mom to a hospital and she waited 24 hours in a hallway. And that sadly is more and more common across York Simcoe and across Ontario. To prioritize healthcare, what we need to do is we have to stop spending money, wasting money where we don't need it. This Liberal government has doubled the size of our debt. And as a result, we're spending $1 billion a month on interest expense. $1 billion would build another hospital. And so when we look at how we are going to fund the things that we need in our province, we need to make sure that we're not wasting money and spending our hard-earned tax dollars in ways places we don't need it. We need to spend it where we do. And that's why we have to stop borrowing money and spending more on interest expense and investing in healthcare where we need it.
I would like to find out, since when the government has been the arbiter of you get a treatment or you don't get a treatment. Like I know enough cases where it has happened that it was a sick person, they wanted to get a certain treatment, the government said no, we are not going to approve it. I'm going to pay it out of my own pocket. No, we are not going to approve it. Why? So look at UK. UK has a dual system. It has the public system, it has the private sector. You don't get anything, you don't get the treatment you want or you need or anything else from the public system. You can go to the private sector at any time. I lived in Germany for 3 years. They had the same thing, dual system. Why not? Why do we hang on to all those anachronic structures?
Very good. You know, there's something wrong when a young fella can go to his pharmacist and get Viagra paid for by the government, and I go in and I have to pay $56 for some eardrops. I guess that tells you where the government's going to you.
I can't imagine. Dental work nowadays?
Well, it just goes on to the point about wasting in the healthcare system. $38 million spent in emergency rooms last year in the province treating dental problems that should have been dealt with before they became strong issues. 220,000 visits to local pharmacists, physicians for advanced dental pain that should have been addressed before the causes got so bad. You know, what we are proposing to do is increase hospital funding by 5.3%. Return the cuts that have been happening to our hospital system over the last number of years. And we want to keep that funding at growing at the inflation rate or better. Let's talk about stop wasting money. We will not get into projects like the previous Conservative government did with private-public partnerships, building hospitals that wound up costing 4 to 5 times what it should be costing us if we fund it publicly.